Straightening your smile can be a time-consuming and often expensive, embarrassing affair, often lasting for years and even creating a look you may not have wanted. But luckily, there's a solution. 6-month braces allows people to develop a healthy, beautiful smile in a very short time. And Dr. Jason Annan from 6-month Braces joins us now with more. Good morning. Welcome back.
Good morning. Good morning.
Now, for those who may have missed it, let's talk about 6-month braces. I'm sure, okay, 6 months is in the name. I'm thinking it takes about 6 months to kind of correct the problem that you may have with your smile.
That's right.
Yeah.
That's right. Everything we do is completed in that 6 to 7 month range.
Yeah. And so what type of preferred dental cases is that really good for?
Well, we're looking for people that are mostly interested in fixing their cosmetic teeth. These are the teeth you smile with, you see when you smile.
Yeah.
The front teeth, if you will.
Okay.
People
just
have
slight imperfections.
Slight imperfections, even some major imperfections we can fix.
Okay. And so how young would you use this on someone?
I do. Anyone over the age of 18. I like to have people who have already grown, they've finished their growth spurt, so they're not going to change face shape on us.
Now let's talk about how it's different from metal braces.
The principles are the same. We use clear tooth-colored braces so that you don't see them when you smile, but we use the same kind of wires, the same kind of brackets that you may have seen other people wear. Just ours are invisible with tooth-colored.
And of course it takes less time to kind of straighten out. And what makes it happen with that in a short period of time? Because I know once I wore braces and it took about a year, a little bit over a year, so it does cut down on the time. But what is it that's different about the technique that can shorten that window?
Right. Well, what we're doing is fixing teeth in a cosmetic way. We're not doing major bite changes. We're not moving the back teeth. And that's how we can get away with doing a shorter treatment time.
Okay, now Dr. Annan, if you can explain what we're seeing here.
Right.
We see a before and after. Let's talk about the problems that the patient has.
This is a great case. This is a fellow who had braces before when he was young.
Okay.
Now he's much older, and he's decided he wants them straight again. And this is the ideal type of candidate we like to see in the office.
So what happens is as you get older, especially if someone who has braces, your teeth still shift. So when you get braces, it's not the end-all be-all to straightening your smile.
Yeah, if you're out there and you haven't worn your retainer and now your teeth have shifted a little bit, then the 6-month braces is an excellent solution for you.
Now, with a follow-up with that, of course, you would still have to maintain after you've worn them for 6 months. There's some aftercare that's involved with that.
Everybody needs to wear a retainer, whether you do traditional braces or 6-month braces.
Okay, and let's talk about costs right quick.
Yep.
What are we looking at?
We try to target our costs at about half to 3/4 of what traditional braces would be. Okay, so much less than a case of veneers and much less than a traditional orthodontics.
All right.
Okay.
All right, sounds good. So they would need to come in and get a consultation with you. How would they do that? How would they get in touch with you?
They can call me. Consultations are free. We'll determine if you're a good candidate and go from there.
All right, Dr. Annan, thank you so much.
Appreciate
and keep
it.
smiling.
Okay.
All right. Now over to John with Whole Foods.